Abscess. Abscess means deposition of the pus. So abscesses can be of pyogenic abscess, metastatic abscess, pyamic abscess and the cold abscess. The most common abscess being the pyogenic abscess. Here we will be learning about the mode of infection, clinical features, investigations, differential diagnosis and the treatment of the pyogenic abscess. And later on we will be learning about metastatic abscess, pyamic and the cold abscess. Pyogenic abscess. As the name indicates, pyogenic. It is a localized collection of the pus in a cavity which is lined by granulation tissue and it is covered by pyogenic membrane. So this is the definition of the pyogenic abscess. So what is pus? Pus is a collection of dead WBC, multiplying bacteria, toxins and the narcotic material. So in the pyogenic abscess, the formation of the pus, macrophages and polymorphonucleosides leads to production of the lysosomal enzymes, causes liquefaction of the tissues and pus formation. So we must be able to differentiate cellulitis from pyogenic abscess. The difference between cellulitis and the pyogenic abscess. In case of cellulitis, it is diffused and it has no edges, whereas the pyogenic abscess is well localized with a clear edge. In case of cellulitis, pus is not seen and it is non-suppurative initially. In case of pyogenic abscess, there is a pus formation. The cellulitis is non-fluctuant, whereas the pyogenic abscess is fluctuant. The nature of the cellulitis is spreading and SIRS, that means systemic inflammatory response syndrome, can occur in case of cellulitis, whereas the pyogenic abscess is usually limited and the blood culture may be negative in case of cellulitis. In pyogenic abscess, the culture for the pus is usually positive. The treatment for the cellulitis, we should never incise the cellulitis. If done, the danger of bacteremia increases. The main source of treatment for the cellulitis is antibiotic, elevation of the foot or the area and dressing. Whereas in cases of pyogenic abscesses, the main source of treatment is the drainage. The mode of infection of the abscess, it can cause directly or hematogenously, lymphatic or by bacteria. The main bacteria involved in abscess formation are the Staphylococcus aureus, Streptococcus pyogenes and gram-negative bacteria like E. coli and Klebsiella. The clinical features are fevers and chills with rigors, swelling which is localized and fluctuate, the throbbing nature of the pain and pointing tenderness is mainly noted, and all the signs of inflammation are seen, that is rubor, calor, etc. Investigations in cases of pyogenic abscess. The total blood count or the total WBC count increases. Urine sugar and blood sugar estimation must be done. CT scan, MRI. In cases of brain or thoracic abscess, blood culture must be done. Partial oxygen and carbon dioxide estimation must be done. And the complications of the pyogenic abscess include bacteremia, septicemia and pyemia. And in cases of breast abscess, antipyoma formation is commonly seen and sinus and fistula formation are also noted. So these are the complications of the pyogenic abscess. And differential diagnosis is aneurysm, soft tissue tumor, hematoma and the cold abscess. Main treatment for the drainage of pyogenic abscess is by the Hilton's method of draining an abscess. In this method, a longitudinal incision is made along the most prominent area of the abscess. It is called as the Hilton's method. Different types of abscesses are the metastatic abscess. So this abscess occurs as a spread from other abscess. For example, lung abscess cause metastatic abscess in brain. The pyamic abscess. The pyamic abscess is from any infective focus which need not be always from an abscess. So this infective focus will cause pyamic emboli which lead to multiple abscesses. So these pyamic abscesses are multiple and deeper and it includes higher mortality rate with systemic inflammatory response syndrome, that is SIRS, and multi-organ dysfunction syndrome, that is MODS. So pyamic abscess is life-threatening condition. It is from any infective focus. So this need not be a spread from other abscess, but it can be a form of any infective focus. It causes pyamic emboli that further leads to multiple abscesses formation in deeper structures of the body, which can lead to multi-organ dysfunction syndrome and systemic inflammatory response syndrome. And the last type of abscess is the cold abscess. This cold abscess is non-reactive in nature and it is a sequel of tubercular infection that commonly occurs in lymph nodes. And cassation of the lymph nodes can form a cold abscess. The common sites of cold abscess formation are the neck and the axilla. If you like this video, do subscribe to my channel.